There's a lot of issues affecting youth mental health right now, especially in 2020 during a pandemic that's unprecedented. One of the major issues that I see and I hear about is suicidal ideation and suicide completion. This issue, unfortunately, seems to drop off our radar every time something more interesting or less sad comes up, and it's not okay because it leaves the most marginalized people at risk. So, for example, those who have been forced to go back to their family homes because there's nowhere else safe to go, who may be in transition, don't have a safe place to be, and this can exacerbate anything that they were feeling to the point of isolation, and for some, increased suicidality. And that's just a small example of some of the people that are suffering during this time. Another issue that's come up in terms of mental health is it's interesting only because no one saw it coming. There is a small population that's been benefiting from this increased social isolation. Some of them were already isolated individuals, and with the onset of virtual care and how easy that's become and how simple it's become to access for people that were already engaged in healthcare, this has been a massive benefit. People have been able to follow through with their appointments finally because they no longer need to think about transportation and how to get from point A to point B. Some people are even able to get specialized virtual care online. But of course, this also leaves a group out who doesn't have access to technology, people who weren't already involved in the healthcare system, who are still stuck on wait lists that may be weeks or months long, and who knows when this will end or when they'll get help. And that could leave them with circumstances that aren't conducive to their wellness, and people are feeling more socially isolated because part of having a case navigator, part of having a person in your life to support you is the fact that they can physically show up, and without that human contact, people feel left behind, they feel uncared for, and there's not much around to show them otherwise, which is sad. The final issue I want to talk about today is harm reduction. It's something that is as divisive as it is entrenched in our society, and it's not only for people that use substances. We use harm reduction every day in our practices. Right now we're social distancing, and that's a form of harm reduction. And what that means is that we are trying to reduce harm for things that we cannot control, right? So if we're during a pandemic and we don't know who has what we can do that's harm reduction is social distance. So how is this impacting those that are most marginalized? As we've heard, people in hospitals, people in shelters don't have access to PPE, personal protective equipment. And this is far-reaching. This goes beyond just face masks. When we think about people who use substances, people who may be your neighbor, people who could be that person you last expect, the availability of testing kits, the availability of naloxone, the availability of these life-saving sites, safe injection sites, is just not there. The capacity has gone down exponentially, and as a result, people are dying. People are feeling isolated. That's caused some to use more, and that's caused accidental overdose. Unfortunately, we're not talking about that as a nation. It's something we need to pay attention to. It's something we need to look to our most isolated communities and reach out and actually help them with this, because it is something that we can do. I don't know all the answers to this pandemic, but there's a few good ideas in there, I think.